All right, for today's technical briefing, we're diving into a virus that, you might not see every day in a European lab, but it's one you absolutely have to be ready for. Venezuelan Equine Encephalitis Virus. It's a high-consequence pathogen, and it really demands our full attention, not just for its natural threat, but for its potential misuse too.
And this quote, well, it gets right to the heart of it. The idea of this virus as a biowarfare agent isn't some kind of science fiction. It's grounded in a really critical lab characteristic. It is incredibly infectious through aerosols. That single fact just skyrockets its threat profile on a global scale, making it a crucial topic for any of us working in high-containment labs.
Just a quick heads up on our sourcing. We put this briefing together using a Gemini deep search. So for anyone who wants to really get into the weeds of the research, all the primary sources are linked right there in the Notebook LM document for you to check out.
So you might be wondering, why are we dedicating all this time to a virus that's mainly found in the Americas? Well, for any microbiologist, and I mean especially in a high-containment facility, the answer is simple: preparedness. Understanding a global threat like this isn't optional, it's non-negotiable. These official labels, they tell a very clear story. Over in the US, the National Institute of Allergy and Infectious Diseases, that's NIAID, calls it a Category B priority pathogen. It demands Biosafety Level 3 or BSL-3 containment. And for us here in Europe, the classification is a direct parallel. It's a Risk Group 3 pathogen. That means the protocols for handling it are just as strict, and it all boils down to that one critical factor. It's high infectivity through aerosols in a lab setting. Okay, so to really understand the threat, we first have to understand the virus itself. Let's dig into its core identity, its taxonomy, and its structure, because that's what dictates everything else, from how we diagnose it to how we might fight it.
So here's the formal breakdown. It's in the Togaviridae family, and its genus is alphavirus. Now, its genome is single-stranded positive sense RNA. And that's key because it means the host cell's machinery can immediately translate it into protein. It's also part of this bigger family, an antigenic complex with 6 different subtypes, which, as you can imagine, really complicates things like epidemiology and vaccine development. This image gives us a fantastic look at the virion. What we're seeing is a spherical particle, tiny, about 70 nanometers across, and it's wrapped in a lipid envelope. Tucked inside, protecting that precious RNA genome, is the nucleocapsid. And you can see it's structured, almost geometric shape, right? That's what we call T=4 icosahedral symmetry. It's an incredibly stable and efficient structure that's pretty common for alphaviruses. This chart is really helpful for placing the virus in the bigger picture of virology. If you look under the enveloped RNA viruses, you'll see it sits right in that positive sense category. This puts it in the same structural class as some very familiar viruses, like coronaviruses and flaviviruses, which of course includes West Nile virus, a pathogen we actively monitor right here in the Netherlands. Okay, let's pivot now from the lab bench over to the clinic, because the impact of Venezuelan equine encephalitis virus on both people and animals is, well, it's dramatic, and it's really what defines its public health importance. So who exactly is most at risk? While a lot of infections can be mild and just feel like the flu, this virus absolutely does not affect everyone equally. The risk of severe disease is actually highly specific to certain groups. And this table just lays out the stark differences. For most adults, getting a neuroinvasive disease from this is rare, less than 1%. But for children, that risk quadruples. And then look at equines, the main amplifying hosts during an epidemic. For them, neurologic disease is common, and the mortality rate can be absolutely staggering, up to 90%. So the key takeaway here is the hugely disproportionate risk to children and to horses.
4%. It's really important to let that number sink in. That represents the rate of encephalitis in children who show symptoms. Now, 4% might sound low, but the outcome can be permanent, devastating neurological damage. And that is exactly why pediatric cases are the #1 clinical concern when we're talking about human infections. Okay, let's bring this all back to the laboratory, our home turf. For any medical microbiologist, getting a rapid ID and then handling it safely, well, those are everything. So in the lab, we've basically got 2 main roads we can take for diagnosis. You've got viral culture, which is the gold standard if you want to live isolate, but it's slow, and you need BSL-3 containment from the second you open that sample. On the other hand, we have our workhorse, molecular detection with RT-PCR. It's fast, it's way safer because you're working with inactivated nucleic acid, and it gives us that high sensitivity and specificity we need to make a confident call. And this is a massive real-world challenge. In places where this virus is endemic, an early infection with Venezuelan equine encephalitis virus looks almost exactly like dengue fever. A misdiagnosis here could be catastrophic. It could mean failing to implement public health measures like vaccinating horses, and that could let an outbreak just explode. This really highlights why rapid, specific molecular diagnostics aren't just a convenience, they're an absolute necessity. And look, if you are working with a live virus, these BSL-3 rules are totally non-negotiable. They line up directly with its EU Risk Group 3 status. Every single manipulation has to happen inside a biosafety cabinet. The personal protective equipment is extensive. We're talking respiratory protection like an N95 or even a powered air purifying respirator, a PAPR, to deal with that aerosol risk. And finally, strict procedures for everything from access logs to decontamination protocols. They are absolutely mandatory. So what happens if a diagnosis is confirmed? What's the next step? Well, this brings us to a pretty stark reality, which can be summed up perfectly with the phrase, no treatment, all control. The focus has to shift completely away from cure and onto management and prevention. Let's be crystal clear on this. There is a universal consensus from the WHO, the CDC, all the major health bodies. There are simply no approved specific antiviral treatments for this disease. Management is 100% supportive care. Now, from a Dutch perspective, the RIVM, that's our National Institute for Public Health and the Environment, doesn't have a dedicated guideline for this virus. And that makes sense, right? It's not endemic here. But what if we get an imported case? The protocol would be to fall back on the existing framework we have for other viral encephalitis, like West Nile virus. For the lab, that means confirming the diagnosis. For the clinicians, it means aggressive, hospital-based supportive care to manage severe symptoms like seizures. And this approach is in perfect lockstep with all the international guidelines. With no treatment on the table, prevention becomes everything. And this is a classic One Health problem. It means we need vector control to knock down mosquito populations. It means personal protection, like repellents to avoid bites. But the single most critical piece of the puzzle is equine vaccination. Vaccinating the horses stops them from becoming amplifying hosts, and that effectively breaks the transmission cycle that leads to those big human epidemics. And that brings us to a final thought, a really important question. We know that the deadly, epidemic strains of Venezuelan equine encephalitis virus have repeatedly evolved from the less dangerous and zoonotic strains that are just circulating in wildlife. So, with no cure in sight, you have to ask, is proactive genomic surveillance of these animal viruses our most vital tool for predicting and hopefully preventing the next major outbreak? And that concludes our technical briefing on Venezuelan equine encephalitis virus. We really hope this was a valuable overview for you. If you work with high-consequence pathogens, we would especially love to hear your thoughts down in the comments. Please subscribe for more deep dives just like this one, and thank you for watching.